Hi everyone, Dr. Mike here. Now, for those of you who are interested in mental health, a really important topic for you to understand is that of alcohol dependence and withdrawal. Now, we know that there's no safe level of alcohol ingestion. Previous studies have demonstrated that moderate drinking is protective for a number of diseases and disorders, but we now know from a Lancet paper that was published last year that even one standard drink compared to no standard drinks is detrimental to your health and increases your likelihood of death. Now, let's talk about what alcohol does to our body. What I've drawn up here is something called the seesaw of alcohol tolerance. Basically, the seesaw is homeostasis. This is balance within the body. And as we know, if something were to tip the seesaw, our body needs to try and bring it back into balance. Now, we know that when we have, in acute phases, short-term drinks of alcohol, we feel relaxed, intoxicated, can have that anesthetic effect, and depending on how much you drink, you may get a little bit of amnesia. Now, all of these effects are due to the way that alcohol plays around with neurotransmitters and their various pathways within the brain or central nervous system. Now, there's two major pathways you need to be aware of. They aren't the entire picture, but they're most of the picture that's going on when it comes to alcohol dependence and withdrawal. These two neurotransmitter systems are that of GABA and glutamate. Now, what you need to understand about GABA and glutamate is this. GABA is an inhibitory neurotransmitter, which means when it's released, neurons don't fire off. Glutamate is an excitatory, so when it's released, neurons are told to fire off, okay? Now, what alcohol does in the body is it increases GABA neurotransmitters, so that stops neurons from firing off, and inhibits glutamate firing neurotransmitters, which tells them to stop firing off. So we get an overall, not stimulatory effect, but inhibitory effect.